Hello everyone. For all you anatomy students who are using a model similar to this, I'm going to give you a quick rundown of these vessels for that last minute studying you might need. Alright, so remember that the heart situates itself here, and so you have your aorta, and it does go inferior all the way down to the abdominal cavity, but you got to make sure to name different parts of it. The part that goes up is called the ascending aorta. The part that curves is the aortic arch. And then as it travels through the thoracic region, it's known as the thoracic aorta, sometimes also known as the descending thoracic aorta. And this descending thoracic aorta will then become the abdominal aorta, or also known as descending abdominal aorta. And now remember that red are arteries, and they are leading blood away from the heart. And so out of this aortic arch, you have your brachiocephalic trunk, which is only on the right side, and it's only the piece that I'm trying to highlight here with my little twig, not the blue. It's underneath this blue vessel. Now, this is going to be your right common carotid. This is going to be your right subclavian. They both stem or come from the brachiocephalic trunk. With that, we see that there are two more vessels, and the good news is you know them now. This is the left common carotid. All right, so it's the same as this one, but this one originates out of the aortic arch. Big difference, it does not have a brachiocephalic trunk. A brachiocephalic trunk is only found on the right-hand side for the arteries. Now with that, once we're done with our left common carotid, we now go to this other vessel known as the subclavian, which will go underneath the clavicle, just like this side. If we look at the veins themselves, you have your superior vena cava, brachiocephalic vein, and then subclavian, just like the artery. Subclavian vein and subclavian artery. Next, you'll see that there are two little vessels here. This is going to be your external jugular, and this is going to be your internal jugular. They empty blood into the subclavian empties into the brachiocephalic empties into the superior vena cava, and that blood will flow into the right atrium of the heart. Keep in mind that this side technically also has an external jugular, it's just not shown on this model. And in the armpit, you have your axillary vein. If there was a red one, it'd be the axillary artery. Now, something to add about these carotid arteries is that the carotid artery, we use this model for a quick example. You can see that this common carotid will branch into an external and internal carotid artery. The internal one obviously will go internally into the skull, and the external one logically will serve structures outside the skull, like muscles, skin. And this internal carotid artery, that one that went into the skull, will feed blood into the cerebral circle, okay? The cerebral arterial circle, otherwise sometimes known as the circle of Willis. And if we focus on the circle of Willis, you can see the internal carotids on both sides. You can see the vertebral arteries. These vertebral arteries are the same ones that you would see running through the vertebra. That's why it's called vertebral artery. And so it's going to lead blood into that cerebral circle eventually. And so you're seeing the pathway here. And then it unites to become the basilar artery. And the basilar artery will circulate blood through these segments here. And you can also see your anterior cerebral arteries. And you can see the anterior communicating artery. Not the best to see some other ones that we need in this lab. And so with that in mind, we now go back to this and we go below the diaphragm. And so this is our abdominal aorta. You have your celiac trunk. The celiac trunk is created by three vessels: the hepatic artery, the gastric artery, and the left gastric artery, I should say, and then also the splenic artery. Then as we look down this abdominal region, we have a few more. We have superior mesenteric, gonadal, both of these, and inferior mesenteric. Here we have our renal artery and our suprarenal artery. For veins, this is your inferior vena cava. This is your renal vein. This is your suprarenal vein. And you can also see a gonadal vein on this side And with that, you can't really see much more that might exist depending on the campus. And I guess that's going to be really case by case dependent what vessels you might need. But on this model, that's all we can see. And so here we have our common iliac artery, and it leads to the external iliac artery and the internal iliac artery. And the internal one will head posterior, the external one would head anterior. And the external one will also feed blood into the femoral artery, which is pretty much going to be in that where your femur bone is. If you look at this thoracic region, you'll see that we have the intercostals. These are posterior intercostal arteries, and this is posterior intercostal veins. And this one, however, has a unique name. This is called your hemiazygos vein, and it will drain blood into the superior vena cava and then into that right atrium. Some other ones that you might see on this model you can get tested for is the red and blue vessels in the lung. As an FYI, it switches colors only in the lungs. This is a pulmonary vein, even though it's red. Remember that rule. And the blue one is a pulmonary artery, even though it's blue. Okay? And that's because deoxygenated blood is traveling away from the heart, and oxygenated blood will return to the heart through the veins. Remember, veins return blood to the heart. Arteries send blood away. Hope it helps.